Hey, Dr. Dave here. It's nice to be with you as always. Just about done seeing patients for the day. I got a couple more here this evening. Did want to just chime back in because I'm reminded of one of the most common symptoms I see every single day in my clinical practice. May surprise you, okay? Any guesses? You know where I'm headed with this? It's really, I think, a toss-up between fatigue and brain fog, right? Why would someone go to see a psychiatrist because of fatigue and brain fog? Well, there are many reasons for that, potentially. I think if you talk to most primary care clinicians, they would tell you that probably poor sleep and fatigue are two of their most common presenting symptoms. All right, so what's this epidemic of fatigue that we're experiencing? I often see it associated with lack of joy, too. There's that anhedonia. Now, I'm just going to give you this kind of once over. We consider in the business these to be part of a collection of symptoms known as negative symptoms, right? Not as in good and bad, positive and negative symptoms. Kind of simplistically, positive symptoms would be things that are there that should not be there, right? Fretfulness, worry, high symptoms of anxiety, anxiousness, right? Weeping and wailing, doom, despair, and agony on me, that kind of thing. Shouldn't be there, right? Positive symptoms. And traditionally in psychiatry, in my practice, those are among the easiest to treat. I can actually treat those relatively quickly, to tell you the truth. But the ones that are really, really hard to treat are what we call the humanity-robbing negative symptoms. Those things that rob each of us of our humanity if we're not careful. They would be the lack ofs. They are things that are not there that should be there. Joy, motivation, reward, energy, gumption, get up and go, right? Clarity of thought, executive functioning. Those are the lack ofs that are really, really hard to treat. Okay. Now, part of the problem is if I really energize folks and give them the dopamine, norepinephrine, PEA, phenylethylamine that they need, right, to, in theory, address those negative symptoms, you run the risk of making those positive symptoms worse. Hence that mixed wired and tired, well, you have equal parts, positive and negative symptoms. Sometimes those folks suffer the most. There are also those that are sometimes most challenging to treat, but I have strategies, naturally, I would say that. Those negative symptoms, however, are the ones I want to focus on a little bit today. Lack of motivation, lack of joy, lack of energy, fatigue, lack of clarity of thought, lack of executive functioning, right? So that's decision making, that's the brain fog. What's that all about? Those symptoms happen to, in general, correlate with high levels of systemic inflammation. We think that those symptoms reflect inflammation at a system-wide level, okay? What's all this inflammation about? Where there's that gut connection, again, whenever I see prominent negative symptoms, right, I'm going to be looking for gastrointestinal symptoms, GERD, bloating, constipation, diarrhea, acid reflux. I'm going to be looking for anything GI, but also anything also related to inflammation. You might be a little bit overweight. You might have trouble losing weight, right? You might have illnesses associated with inflammation. It's interesting, and I don't know a lot of psychiatrists that do this, but when I'm measuring blood work, my routine blood work, I'm going to get a measure of systemic inflammation just to see where I'm at. There's actually some data in psychiatry, I'm digressing a little bit, but what kind of antidepressant do I use if you meet syndromal criteria for major depression? That's an interesting story, right? We'll talk about that another day. It turns out that high sensitivity CRP, a single measure of systemic inflammation, can help me decide what kind of antidepressant to use in you. Isn't that interesting? A lot of people know that. All right, back to treating those negative symptoms. Most people who come to me don't meet criteria for depression, don't meet criteria for schizophrenia or bipolar disorder. Can't really use meds to help their suffering. I mean, I could make up a diagnosis, I guess, and give them an FDA-approved treatment, but I'd rather not do that. I'd rather give you something that is specific to your symptoms and your biochemistry. So I'm going to measure things. I'm going to measure your neurotransmitters, your adrenal output. I'm going to measure systemic inflammation. And what I have found over decades of doing this, if you present with fatigue, lethargy, brain fog, lack of motivation, lack of joy, having trouble managing your weight, I'll bet you by golly, wow, that you are inflamed. How does that inform my treatment recommendations? Well, what are my best anti-inflammatory supplements? A good probiotic, fish oil, NAC, N-acetylcysteine. For starters, a lot of D3, okay? Might give you a little bit of leaky gut repair to seal and heal that presumably leaky gut. These are all approaches that I might take in addition then to giving you some neurotransmitter support of those chemicals we know to generally be associated with energy, focus, concentration, motivation, namely PEA, phenylethylamine, dopamine, norepinephrine. Do I have an approach? Naturally. Anyhow, if you're interested in talking about that or learn more about that, let me hear from you. But those are the most common symptoms I saw today, and those are the most common symptoms I see every single day in my practice. All right, enough about me. Let me hear from you. Peace out, and until next time, be safe and stay sane. All right, thanks.